They thought they were prepared at Oak Springs Care Home in Liverpool. It made no difference. 16 of their residents have died, making it one of the hardest hit in the country. And only 2 were tested, and only when taken to hospital.
This is the worst time that I've ever experienced. 16 residents is like losing 16 grandparents in such a short space of time. You spend so much time every day with residents, more than you do with your own family members.
With 8 residents still isolated, they remain worried and say the government left them to fend for themselves.
I feel that they let us down. They had the information from other countries, the information on how it had affected their care homes, but failed to prepare our care homes ready. What we wasn't prepared for was that a GP is not going to come out, that resident's not going to be taken to hospital, that you're going to be given a course of antibiotics and a prescription of paracetamol, that no oxygen is going to be delivered should that resident become breathless.
The staff filmed these pictures for us, putting on protective outfits which are inferior to those in hospitals. And in this home's case, they've been dealing with numbers equivalent to several hospital wards. At one stage, more than half the staff were off work with no access to tests. They don't recognise the Health Secretary's claims.
From the start, we've been testing people in care homes. As I said, there's more than 10,000 of those tests that have been done throughout. And we know that 85% of our care homes do not have an outbreak of COVID-19.
But Sky News has spoken to 3 of the UK's largest care home providers with hundreds of homes between them and found around 60% have coronavirus cases. If that's replicated in thousands of others, the infection rate is far higher than admitted. And in Oak Springs, the testing claims are far too late.
3 weeks down the line, to me now, it's no good. I had to take care of my care home, my residents, with less than 50% of my staff because the government didn't have their action plan ready to be actioned straight away.
And more than 30 MPs have written to the Health Secretary taking issue with his claims of testing in the care home sector.
Well, certainly the assertion made by Matt Hancock and indeed the Chief Medical Officer is not substantiated by the evidence that me and my team have collected. We've phoned all the care homes in my constituency and there has been no testing whatsoever, even in those care homes where there has been signs of COVID-19.
The government says the lockdown has slowed community infections, but the scientists admit it's still spreading in care homes.
It means in the community, it's likely that the virus and the epidemic is now shrinking. There are areas such as hospitals and social care settings where there may be growth in some places.
The staff at Oak Springs have been called astonishingly courageous. They all agree testing and an earlier government lockdown of care homes would have made a critical difference.
People knew this was coming before it came, higher people than us, and I think it could have been prevented and lives could have been saved. That's my opinion.
They've described it as the worst 3 weeks ever, abandoned, they say, to cope with the deadly virus on their own. Alex Crawford, Sky News, Liverpool.